Hello everyone, welcome back to the channel. Today we are going to discuss a very common but often ignored condition in men, especially after the age of 50, benign prostatic hyperplasia, commonly known as BPH or enlarged prostate. In this video, we will understand its symptoms, diagnosis, treatment options, and whether it can be completely cured. This is an extremely important topic because early diagnosis can prevent serious complications involving the bladder and kidneys. So, watch this video till the end. Many men after the age of 50 start experiencing urinary problems like frequent urination, waking up multiple times at night to pass urine, which we call nocturia, weak urine stream, and difficulty in starting urination. Some patients also feel that even after passing urine, the bladder is not completely empty. These symptoms may seem small initially, but they can significantly affect quality of life. Many people immediately become worried and think, is this prostate cancer? But in many cases, the reason is actually benign prostatic hyperplasia, which is a non-cancerous enlargement of the prostate gland. First, let us understand what the prostate is. The prostate is a small walnut-sized gland found only in males. It is located just below the urinary bladder and surrounds the urethra. The urethra is the tube through which urine passes out of the body. Now imagine this. If the prostate enlarges, it starts pressing on the urethra like a clamp. As a result, urine flow becomes obstructed. This non-cancerous enlargement of the prostate is called benign prostatic hyperplasia. Benign means non-cancerous and hyperplasia means increase in the number of cells. Very important point, BPH is not prostate cancer. These are two completely different conditions. Now the question is, why does BPH happen? One major reason is a hormone called dihydrotestosterone or DHT. DHT is formed from testosterone and plays a major role in prostate growth. As age increases, hormonal balance changes. This increases the effect of DHT and gradually the prostate starts enlarging. Some important risk factors include increasing age, family history, obesity, diabetes, lack of physical activity, and hormonal imbalance. This is why BPH is much more common in older men. Now let us discuss symptoms. The first group is called obstructive symptoms. This happens because the enlarged prostate compresses the urethra and blocks urine flow. Common symptoms include weak urine stream, straining during urination, dribbling of urine at the end, feeling of incomplete bladder emptying, and in severe cases, complete urinary retention. Some patients say, Doctor, urine starts very slowly and stops in between. These are classic obstructive symptoms of BPH. The second group is called irritative symptoms. This happens because the bladder becomes irritated due to constant obstruction. Common symptoms include increased frequency of urination, urgency meaning sudden strong urge to urinate, nocturia meaning waking up at night multiple times, urge incontinence where urine may leak before reaching the toilet, and disturbed sleep. Patients often complain, Doctor, I cannot sleep peacefully because I keep waking up all night. This affects both physical health and mental peace. Some symptoms should never be ignored. These are called red flag signs. These include blood in urine, fever along with urinary symptoms, complete inability to pass urine, severe lower abdominal pain, recurrent urinary tract infections, and worsening kidney function. This may indicate serious complication and require immediate medical attention. Do not delay consultation in these situations. Now let us understand how doctors diagnose BPH. Diagnosis starts with clinical history. The doctor asks detailed questions about urinary symptoms, how often you urinate, whether you wake up at night, whether urine flow is weak, and whether urinary retention has occurred before. Doctor may also use something called IPSS score, which stands for International Prostate Symptom Score. This helps measure the severity of symptoms. Another very important examination is digital rectal examination or DRE. In this, the doctor checks the prostate through the rectum using a gloved finger. This helps determine whether the prostate is enlarged, smooth, or irregular. A smooth enlarged prostate usually suggests BPH, while a hard irregular prostate may raise suspicion of cancer. Another common test is PSA test, which means prostate specific antigen. This is a blood test, but remember, PSA is not a direct test for BPH. It mainly used when prostate cancer is suspected. Other important investigation include urine routine examination. This helps rule out infection, blood in urine and other urinary problems. Ultrasound helps assess prostate size, residual urine left after urination, bladder wall changes and kidney involvement. Uroflowmetry. This test measures the speed of urine flow. Low flow may indicate obstruction. Cystoscopy. This is not required for every patient. It is used in selected cases like severe obstruction, blood in urine, or before surgery. Together, these tests help confirm diagnosis and guide treatment. Treatment depends on symptom severity. For mild cases, lifestyle changes can make a huge difference. These include reducing fluid intake at night, avoiding alcohol and excess caffeine, regular exercise, maintaining healthy body weight, avoiding constipation, and proper diabetes control. These may look simple, but they can significantly improve symptoms and reduce progression. When symptoms become moderate or severe, medicines are required. The first group is alpha blockers, such as Tamsulosin. This relaxes the muscles of the prostate and bladder neck, which improves urine flow and gives quick symptom relief. The second group is 5-alpha reductase inhibitors, such as Finasteride and Dutasteride. These reduce DHT levels, which gradually decreases prostate size. Relief is slower, but they are excellent for long-term management. Many patients are given combination therapy like Tamsulosin plus Dutasteride because one provides fast relief while the other prevents progression. This is one of the most common prescribed combination. Now the important question, when is surgery needed? Surgery becomes necessary when medicine fails, recurrent urinary retention occurs, repeated urinary infection develop, bladder stones are present, kidney damage starts, or symptoms become severe. The most common surgery is TURP, which stands for transurethral resection of the prostate. This is considered the gold standard treatment. In this procedure, an instrument is passed through the urethra and the excess prostate tissue is removed. No external cut is needed. Other newer, minimally invasive options include laser surgery, HOLEP, PUL, water vapor therapy, and prostatic artery immobilization. This provides faster recovery in selected patients. The most important message from this video is do not ignore urinary symptoms. Many people think this is normal with age, but untreated BPH can lead to bladder damage, recurrent infection, kidney failure, and emergency urinary retention. Early diagnosis means easier treatment and better long-term outcomes. If symptoms are recognized early, serious complications can be prevented completely. If you or someone in your family experiences frequent urination, waking up multiple times at night, weak urine stream, or difficulty passing urine, please consult a doctor or urologist because prostate problems are common, treatable, and manageable. If this video was helpful, please like, share, and subscribe to the channel and let me know in the comments which medical topic should I cover next. Thank you for watching. See you all in the next medical video.